Question number 1. Which one of the following drug has cholinergic property? The option given are amitriptyline, clozapine, galantamine and chlorpromazine. The right answer for the question is option number C, because galantamine is an example for anticholinesterase. That means the drug is going to inhibit cholinesterase enzyme, thereby accumulating acetylcholine. So remember, galantamine is a cholinergic drug because it is a anticholinesterase. This drug useful for the treatment of Alzheimer's disease. We know in Alzheimer's disease the problem is deficiency of acetylcholine. So for the treatment of Alzheimer's disease we need cholinergic enhancers. So what are all the cholinergic enhancers useful for treatment of Alzheimer's disease? Think of rivastigmine, donepezil, galantamine, tacrine. These for cholinergic enhancer useful for treatment of Alzheimer's. In that, tacrine, a dangerous drug causing side effect of liver damage. Because of causing hepatotoxicity, tacrine is not in use. Other than these four drugs, you should know one more drug named by memantine. Memantine is an example for NMDA blocker. It is approved for treatment of moderate to severe Alzheimer's disease. So remember, memantine, a NMDA blocker, approved for treatment of moderate to severe Alzheimer's disease. So answer for the question number 1 is option C. Now coming to other option, option A, amitriptyline. Amitriptyline actually an example for tricyclic antidepressant. We know the common mechanism of action of all the tricyclic antidepressant is inhibiting reuptake of both serotonin and norepinephrine. It's a common mechanism action. But in addition to this action, majority of TCA having additionally antihistaminergic action, anticholinergic action and alpha blocking action. So remember, TCAs are primarily acting by inhibiting reuptake of serotonin and norepinephrine, but they have additionally antihistaminergic, anticholinergic and alpha blocking property. Coming to option number B, clozapine. Actually speaking, clozapine is an example for atypical antipsychotic. We know the common mechanism action of all the atypical antipsychotic is blocking 5-HT2, the serotonin blocker. But clozapine, in addition to having 5-HT2 blocking action, it is also having antihistaminergic action and then anticholinergic action as well as alpha blocking action plus D4 blocking property. It is also having D4 blocking property. Now coming to last one, chlorpromazine. It's a primarily a D2 blocking typical antipsychotic agent. Remember, the chlorpromazine also having additionally antihistaminergic, anticholinergic and alpha blocking property. That means in this given question, option A, B, D also having anticholinergic action. So the answer for the question 1 is option C, galantamine. That finishes important aspects of galantamine and the remaining points. Question number 2. Which one of the following drug has potent inhibitory action on phosphodiesterase enzyme PDE? The option given are prazosin, terazosin, silodosin, tamsulosin. Look at the point doctor. all the given drugs are alpha 1 blocker. So question, among the alpha 1 blocker, which drug having phosphodiesterase enzyme inhibitory action? The right answer for the question is option number A, prazosin. Remember, prazosin, a alpha 1 blocker, additionally having phosphodiesterase enzyme inhibitory activity. Prazosin useful for treatment of hypertension as well as useful for relieving symptoms of benign prostatic hypertrophy, and the most commonest side effect of any alpha 1 blocker is postural hypotension. Now coming to other options, look at option B, terazosin. One interesting point, among the alpha 1 blocker, terazosin and one more drug called doxazosin. These two drugs having apoptotic effect on prostate. Actually, prostate size can be reduced by 5 alpha reductase enzyme inhibitor like finasteride, whereas alpha 1 blocker giving only symptom relief in BPH. But among the alpha 1 blocker, terazosin and doxazosin having apoptotic effect on prostate. And look at the option number C and D. Very interesting question. Silodosin, tamsulosin. These two drugs are selective alpha 1A blocker. The alpha 1A receptor mainly seen on bladder. So silodosin, tamsulosin mainly acting on alpha 1 that presenting in the bladder called alpha 1A receptor, and they are very much useful for relieving symptoms of benign prostatic hypertrophy. Extra one point, actually very important point, whenever a patient, that is elderly patient having BPH, for them we give tamsulosin or silodosin. Remember, the elderly patient also having cataract problem. So when they are undergoing cataract surgery, imagine if elderly male patient, imagine on tamsulosin drug, that is alpha 1 blocker drug therapy. If he undergo cataract surgery, during operation, he may develop one intraoperative complication called flappy iris syndrome. So MCQ question is, flappy iris syndrome is an intraoperative complication of cataract surgery in a patient on what drug therapy? Remember, alpha 1 blocker therapy like tamsulosin. This may cause flappy iris syndrome during cataract surgery. So that finishes the importance of question number 2. Question number 3. Which one of the following drug having the risk of causing extrapyramidal side effect, EPS? The option given are clomipyramine, toxipine, imipyramine, amoxapine. Look at carefully all the options. All the options given in these questions are belonging to tricyclic antidepressant group. In this, which one of following drug having risk of causing EPS? The right answer for the question is option number D, amoxapine. Remember first point, all the option A, B, C, D all are belonging to a group of drug called tricyclic antidepressant. We know the common mechanism action of all the tricyclic antidepressant is inhibiting reuptake of both serotonin and norepinephrine. It's a common mechanism. In that, amoxapine, a special drug, the drug in addition to inhibiting reuptake of serotonin and norepinephrine, amoxapine having additionally D2 blocking property. Because of D2 blocking property, it has antipsychotic action also. So first important question, a antidepressant additionally having antipsychotic action is amoxapine. One more MCQ, because of blocking D2, it also causes side effect of extrapyramidal side effect and also having risk of causing galactorrhea. So remember, a antidepressant causing extrapyramidal side effect is amoxicillin because it has additionally D2 blocking property. Now coming to other option, look at the first option A, clomipramine. Clomipramine, a tricyclic antidepressant approved for treatment of OCD, obsessive compulsive disorder. So find out the TCA approved for treatment of OCD mean answer clomipramine. But for OCD nowadays the first line drug of choice mean SSRI. That also important question. Next option doxepin. Doxepin, a tricyclic antidepressant having very high antihistaminic property. Because of having high antihistaminic property, it is useful for treatment of skin allergy like atopic dermatitis and also lichen simplex. So to control the itching, to control the pruritus, doxepin, a TCA given topically for controlling itching in case of atopic dermatitis. Now look at the option number C, imipramine. Imipramine, a tricyclic antidepressant having very high anticholinergic property. This point very important. Because of having very high anticholinergic property, it causes urinary retention. That property useful for treatment of nocturnal enuresis. So question, imipramine because of having high anticholinergic property causes urinary retention. That property was used for treatment of nocturnal enuresis. But for nocturnesis, the drug of choice is desmopressin, a synthetic V2 analog of vasopressin. That finishes importance of question number 3. Question number 4. All of the following are GABA analogs useful in treating epilepsy except the option given are tiagabin, isogabin, stiripentol and one more option vigabatrin. The right answer for the question is option number B, isogabin. Remember, isogabin, a newer drug, it's a potassium channel opener useful for the treatment of partial seizure. Remember, isogabin is a potassium channel opener. Now look at the other option. Tiagabin, a GABA analog acting by inhibiting the reuptake GABA useful for epilepsy. And option C, stiripentol, one very important newer GABA analog useful for treatment of Dravet syndrome. Dravet syndrome means severe myoclonic epilepsy of infancy. For treating this condition, we use a drug called stiripentol. It's a newer drug, GABA analog. Option D, VIGA, vigabatrin, or we call vigabatrin. Actually, it's a GABA transaminase inhibitor useful for treatment of infantile spasm with tuberous sclerosis. Vigabatrin, a GABA transaminase inhibitor useful for treatment of infantile spasm with tuberous sclerosis. So answer for question 4 is isogabin is a potassium channel opener. Now coming to question number 5. Chlorthalidone increases urinary excretion of all of the following except. Options are sodium, chloride, calcium, magnesium. The right answer for the question is option number C, calcium. Remember, chlorthalidone, a thiazide diuretic, and thiazide diuretic acting on distal convoluted tubule, and they are acting by inhibiting sodium chloride symport. So thiazides are acting by inhibiting sodium chloride symport. The thiazide diuretic loses so many ions in the urine like sodium, chloride, potassium, magnesium and H+. But remember, thiazide diuretic causes reabsorption of calcium. This point is very important, very important. Thiazide causes retention of calcium, resulting in hypercalcemia. Based on this property, thiazide can be useful for treatment of hypocalcemia in post-menopausal women for treatment of osteoporosis, and because of inhibiting calcium excretion through urine, it is useful for controlling nephrolithiasis and also useful for one condition called Williams syndrome. It's an idiopathic hypercalciuric condition. In this case, to control urinary excretion of calcium, we can use thiazide. So, thiazide diuretic causes calcium reabsorption, whereas remember, loop diuretic loses calcium in the urine. So, one important question, loop diuretic, thiazide diuretic having opposite action on which ion mean? Calcium ion. Thiazide causes calcium reabsorption, loop diuretic causes loosening of calcium in the urine. This is a very important point. Now question, sacubitril is a dash. Options are AC inhibitor, Neprilysin inhibitor, encapsulinase inhibitor. Option D, it's ACE plus Neprilysin inhibitor. The right answer for question is option number B, Neprilysin inhibitor. Remember, we have Neprilysin enzyme. It's also called neutral endopeptidase or simply called vasopeptidase enzyme. There are some selective Neprilysin enzyme inhibitor we having, that includes Iguaratimod and sacubitril. Remember, Iguaratimod and sacubitril are selective Neprilysin inhibitor. Whereas, what is the example for encapsulinase inhibitor? Encapsulinase blocker name is rasigodotril. This drug, by inhibiting encapsulinase enzyme, accumulate encapsulin, that means useful for treatment of diarrhea. Drug name rasigodotril. And finally, there are some drugs going to inhibit both angiotensin converting enzyme as well as Neprilysin enzyme. So, the drug inhibiting both ACE and Neprilysin enzymes are omapatrelot and sampatrelot. Remember, omapatrelot and sampatrelot are inhibiting both angiotensin converting enzyme as well as Neprilysin enzyme. That finishes question number 6. Now coming to question number 7. IDA, Idarubizumab, is useful for the reversal of action of which one of the following drug? The option given are dabigatran, rivaroxaban, warfarin, nadraparin. The right answer for the question is option number A, dabigatran. This is very important MCQ, so kindly listen sincerely. Dabigatran and one more drug, XIMELE, Zymelagatran. Both these drugs are direct oral 2A inhibiting anticoagulant. Dabigatran, Zymelagatran are orally given direct 2A inhibitor group of anticoagulants. In this, the Zymelagatran causes severe hepatotoxicity, so this drug is not in use. So the one and only oral direct 2A blocking anticoagulant is dabigatran. Any anticoagulant causing side effect of bleeding. So to reverse the action of dabigatran, we have one antidote called IDA, Idarubizumab. It's a newer drug useful for reversal of action of dabigatran. Now look at the option B, rivaroxaban. Rivaroxaban is a orally given direct 10A inhibitor group of anticoagulant. For reversal of 10A blocker, we have one drug called andexanet alpha. It's a recombinant 10A analog called andexanet alpha given intravenously. It is an antidote for oral direct 10A blocking anticoagulant. But for both 2A and 10A, for both the category, we have one common antidote called Siraparentac. Siraparentac, a newer drug useful for the reversal of action of both 2A blocker and 10A blocker. So, common antidote for both 2A and 10A blockers is Siraparentac. Coming to option C, warfarin. Warfarin, a oral anticoagulant. For this, a specific antidote is vitamin K1. K1 chemical name is phytonadione. It is a specific antidote. But to control the bleeding immediately, for immediate hemostasis, we can use fresh frozen plasma, because the fresh frozen plasma containing all the vitamin K dependent clotting factors. And finally, option D, nadraparin. Actually, nadraparin is a low molecular weight heparin. For LMWH, there is no specific antidote. But for heparin, we have antidote. The specific antidote for heparin is protamine sulfate. Remember, protamine is an antidote for heparin. Remember, heparin is the acidic drug. Protamine is a alkali drug. So, a alkali protamine antagonizing acidic heparin is an example for chemical antagonism. So, protamine is a chemical antagonist of heparin. And one more point, 1 milligram of protamine able to antagonize 100 units of heparin. That's a very important point. That's about question number 7. Question number 8. From the given image, find out the true statement. Options are: drug B less potent but equally efficacious as drug D. Option B, drug C is less potent and more efficacious than drug A. Option number C, drug D is more potent and more efficacious than drug B. Option D, drug A is more potent and equally efficacious as drug B. Like that, the given option. This is very important question, doctor. In your NEET paper, image based questions are commonly coming, so please listen the image. This image shows dose response curve. Based on the DRC, I have framed the question. First, the answer for the question is option number D. Why this is the right answer? For that, we should know how to study a dose response curve, and then it's easy to understand. For example, okay, dose response curve. In the x-axis, I put log doses value. That is, I am starting the dose, point bar 10, bar 1.3 is a dose. For this dose, how much response I am getting? The responses I put in y-axis. So, doses I am plotting in the x-axis. For that dose, how much response I am getting? The response I put in y-axis. So, I am putting a graph. That graph is called log dose response curve. Here, first MCQ question, the shape of the log dose response curve will be sigmoid in shape. That's one point. Second important point is, in this dose response curve, look at the height. As I increase in dose, I am getting increasing response. One time I am getting a very high response. It is called maximum response. I put MR. MR means maximum response. That means 100% response. This response is called as efficacy of the drug. So, to see the efficacy of the drug, look at the height of the curve. Look at the height of the curve. And the dose at which I am getting a high response, this dose is called maximum dose, MD, maximum dose. Whereas there is a dose at which I am getting 50% of the max response. This dose is called as ED50. ED means effective dose 50. This indicates potency of the drug. So, for looking the potency, look at the ED50 value. So, question, if I am getting a very good response even on low dose, that drug is more potent. That means lower the ED50, higher the potency of the drug. So, I am repeating, doctor. For efficacy, look at the height of the curve. Look at the height. Whereas for potency, look at the ED50 dose, this dose. Based on this curve, I have some question for you. Look at this. I have three drugs. Drug A, drug B, drug C. I am putting dose response curve of drug A, B, C. The dose value started here, increasing and gradually increasing dose. The low value, gradually increasing dose is the x-axis. Response in the y-axis. Now, when you compare these three drugs, look at the drug C. The drug C having small height. That means among the three curves, it has less efficacy. And only at high dose, it getting response. So, less potent. So, among the three graphs A, B, C, C is less potent and less efficacy. Whereas among the three drugs, drug A, even the low dose getting very good response. So, it's more potent. Among the three curve, A, B, C, three curve, drug A is most potent. And among the three curve, when you compare, the drug A and drug B having same height, same maximum response. That means same efficacy. So, the take home message, when you look at this picture, in this picture, first take home message, among the three curve, drug C is less potent and less efficacy. Yes. Among the three graph, drug A is the most potent. On comparison, drug A and drug B having equal efficacy. So, this type of efficacy potency based questions are important. So, you should know how to compare the DRC. And one more point you should know. Come on, imagine it's a dose, it's a response, one curve, DRC, dose response curve. The question may be, what happened to DRC in the presence of competitive antagonist? Like that question can be framed. In the presence of competitive antagonist, the DRC will be shifted parallelly towards right. When shifted to right mean the height is same, that is efficacy remains same, but potency get decreases. So, the question, what happened to DRC in the presence of competitive antagonism? Mean the DRC will be shifted parallelly towards the right. In this case, efficacy remains same, potency get decreases. The same model question, that is, what happened to dose response curve in the presence of non-competitive antagonist? In the presence of non-competitive antagonist, the height of the curve become decreases, coming like this. It's not shifting anywhere, only height alone decreases. That means only height alone decreases means efficacy decreases, potency remains same. So, in the presence of non-competitive antagonism, the DRC height alone coming down but not moving anywhere. That means efficacy decreases, potency remains same. These are very important points regarding dose response curve. Next important question, which one of the following H2 antagonist having nitric oxide releasing property, thereby increasing healing of gastric ulcer? Option given are famotidine, ranitidine, lafutidine and laxatidine. The right answer for the question is option C, lafutidine. Remember, all the given options are H2 blocking drug useful for treatment of gastric ulcer. In that, a newer drug, lafutidine, having additionally nitric oxide releasing property, thereby causing vasodilatation, improving the blood supply to the ulcer area, thereby promoting ulcer healing. And lafutidine also increases mucus production. The mucus will be acting as a barrier, thereby preventing the ulcer from contacting with the acid. So ulcer protection, ulcer healing also possible with the lafutidine. Such a important drug, lafutidine, a H2 blocking drug useful for treatment of gastric ulcer. Coming to remaining option, famotidine. Among the H2 blocker, the most important H2 blocker is famotidine. Next option, ranitidine. So most commonly used drug, but recently there is some controversy. The ingredient may cause some gastric cancer, but now we are using ranitidine. And last, one more important option, loxartidine. Very important. Why mean? Loxartidine is a one and only H2 blocker, non-competitively inhibiting H2 receptor. Other drugs are competitively blocking H2. So the one and only non-competitive H2 blocker useful for treatment of gastric ulcer disorders, loxartidine. That finishes question number 9. Now coming to question number 10. IgU, Iguaratimod, is useful in dash. Options are psoriasis, rheumatoid arthritis, atopic dermatitis, bronchial asthma. The right answer for the question is option B, rheumatoid arthritis. Remember, Iguaratimod, a newer drug, mechanism action is inhibiting NKFB. NKFB, nuclear factor kappa light chain enhancer of activated B cell. By inhibiting NKFB, ultimately it is going to inhibit COX-2 enzyme, thereby inhibiting production of inflammatory mediators, and is also inhibit several other inflammatory cytokines, thereby useful to control inflammation in case of rheumatoid arthritis. So newer drug useful for rheumatoid arthritis.